Uganda is regarded by many observers as East Africa's food basket. That observation is evidenced by the large amount of foodstuffs grown in the countryside that end up being sold in the markets. With such food varieties available, one would not believe that the levels of malnutrition in the country are high. Nutrition reports from organizations like World Food Programme, United Nations, Food and Agriculture Organization show that over 7 million children in Uganda die from preventable diseases due to malnutrition. Nutrition consultant Mpima Jamiru says malnutrition is a condition that can be brought about by eating a diet in which nutrients are either too little or too much.
Undernutrition is whereby the body is getting less than what it should get. Meaning you are eating food, but maybe part of the food you are eating is lacking some or more of the nutrients the body is expected to get. Overnutrition on the other side is whereby someone is getting an excess. The major form of overnutrition is obesity.
Mpima says that Uganda is currently suffering both over and undernutrition, which is detrimental to the population. He says the most vulnerable groups are the elderly, women of reproductive age, and children under 5 years.
So when you look at the under 5s, these are people who, these are children who are being looked after. So meaning everything is provided for them. But in some cases, they may not be able to get what they deserve.
He adds that malnutrition has led to stunting of up to 33% of all children under 5 years in the country.
Meaning these children are shorter for their height or for their weight.
Another 7% of children are reported to be wasted.
Or they are having that severe malnutrition whereby you see someone has wasted muscle, they have a pot belly, they have brown hair. So some of those signs which you can easily see are for wasting.
According to UNICEF, stunting is defined as height for age below -2 standard deviations from the median height for age of the standard reference population, and wasting as weight for height below -2 standard deviations from the median weight for height of the standard reference population. A Ministry of Health report, National Nutritional Planning Guidelines, released in 2015, acknowledges that Uganda still faces numerous undernutrition and overnutrition challenges with variation across the regions. It notes that the low-income populations are most affected by stunting at 45%. Children of mothers with no education at 19% were more than twice as likely to be stunted as children born to mothers with a secondary school education that account for 8%. In addition, children born to undernourished women with a body mass index less than 18.5 are more likely to be underweight or wasted than children born to well-nourished or overweight women.
The levels are increasing, which is called the double burden of malnutrition, whereby you can even find in the same household, the parents are overweight, but these children are very underweight, or they are stunted, or they are wasted.
Calculation of the hunger index combines 4 component indicators, including the proportion of the undernourished as a percentage of the population, the proportion of children under the age of 5 suffering from wasting, proportion of children under the age of 5 suffering from stunting, and the mortality rate of children under the age of 5. Mpima says it is usual that parents are not aware of their children's status.
Unless someone goes ahead to go to the hospital to take the measurements, you will never know that someone is anemic. You will never know that someone is getting stunted. For you may think this child is maybe just short. You think maybe this child is just small, but when they are really stunted or they are wasted. And this doesn't happen to people in the villages, because sometimes when we talk about malnutrition, people think that it's only for the poor, but even in the rich, 14% of the rich people have children who are undernourished, despite the fact that they have the food and everything at their disposal.
Dr. Labias Mutanda, a retired medical officer who is now involved in research of nutritional medicine, urges people to watch their diet while feeding. He says not all food is good for our bodies, especially when one is ill.
You have to eat moderate fat, protein, and we are putting emphasis on vegetables.
Dr. Mutanda says pregnant mothers are a category of people that have to be careful of what they eat to avoid producing malnourished children.
Puta, it has got mercury. We don't know whether ours has got a lot or a little mercury, you see, because in America it is not recommended for pregnant women. Cassava also, sometimes it can be dangerous, you see. It can develop toxin.
Malnutrition poses a danger to our population by affecting human capital development and productivity, causes lifelong and irreversible damage, and increases childhood deaths and a loss of productivity, among others. It has also weakened the economy due to poor physical status, low school performance, attainment of low levels of education or low grades as a result of impaired cognitive development, and many days of morbidity, resulting in lower wages for non-manual work and through increased health costs associated with treating malnutrition and related diseases. Mpima says a number of urgent interventions are required from the government to curb malnutrition, including provision of a food and nutrition law, provision of a standalone sufficient budget, among others.
In this plan, there is the structure of the Food and Nutrition Council. That council is supposed to be a coordinating body between the different ministries which are involved in the nutrition of this country. It's also supposed to put up these structures which are called the District Nutrition Coordination Committees. Another simple intervention is trying to create awareness. Like we have seen, so much awareness is being done on malaria, HIV.
Walter Mwesije, NTV.